Hey guys, how you study in nursing school is so important, and it takes a lot of tweaking and trial and error and changing this and opting out of that to really create an effective study plan, okay? I'm in my last semester of nursing school and I'm still changing and adding and finding so many ways to improve my studying, get down to what I need to know as a nurse, nursing interventions, the medications that I'm going to administer for this type of problem, what my patient is going to look like, sound like, smell like, assess. Assessment is number one. With any nursing care, always assess your patient first, guys. Just know that your study plan is never going to be perfect. Depending on the topic or the specialty, you're going to have to integrate more, or you're going to have to take out something. But in the end, you want to cover all your bases, your interventions, your meds, your procedures, your lab tests, your diagnostic tests, your nursing assessment, just the whole nursing process. So you want to start out with books,
there are many different
videos
that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease.
Calcium channel blockers.
Develops high up in the uterus. Sudden vaginal bleeding.
notes, and PowerPoints. You also want to use other resource books that are going to help you learn about your disorder or your illness, disease. One I recommend is looking in your nurse's pocket guide. A patient with COPD, for example, they have an ineffective breathing pattern as well as ineffective airway clearance, also impaired gas exchange. Look up the nursing diagnosis that go with your disease that you're talking about. Look up the types of diagnoses that go with those disorders, and then look at the nursing interventions. What are you going to do for impaired gas exchange? What are you going to do for ineffective airway clearance? What are you going to do for activity intolerance? And also, you want to use books like Mosby's Fluid and Electrolytes to help you get through your fluid and electrolytes tests, or Mosby's Pharmacology memory note cards. These are just books that add onto my MedSurg books or my OB books. They just give me additional information. You want to use as much resources as you can, and you want to make sure that they're easy to read. Now, when studying, you want to prioritize your time as to what are you going to spend the most time studying, what are you going to study first, and what are you going to study next. A great way to study and to put everything together by using templates. Using a template covers the assessment, the risk factors, the psychosocial concerns, labs and diagnostic tests, the medical diagnosis, as well as the nursing diagnosis, potential and actual complications from treatment/procedures, nursing interventions, medications, and patient teaching. Also, the use of index cards. Now, I do not recommend writing index cards for everything. When I first started out in nursing school, my first semester, I wrote index cards for days. And what happens is you write so much that you're not able to go back and study them. You're just always writing note cards for everything. Know what you need to write note cards for. I would recommend writing note cards for things that you need to memorize, lists that you need to memorize. Like, for instance, your fluid and electrolytes. Fluid and electrolytes is memorization. For example, I have hyperkalemia, and I have the level of it when it's hyper, as well as the causes, the symptoms, and interventions.